Hi, Dr. Roseann here, and today we're talking about what is autism. I'm an integrative and pediatric mental health expert who's on a mission to change the way we view and treat children's mental health. If you're new to my channel, hit subscribe and turn on your notifications so you get my videos every week. Let's dive in. So you may have heard of autism, but you may not know the signs and symptoms and really what is autism. Autism is dramatically on the increase. According to the CDC, 1 in 59 children have autism today, and it's even more for boys. What are some of those signs and symptoms of autism? In general, across all ages, what you're going to see is a high rate of repetitive behaviors. And we often think of autism as a child hand flapping or some other very observable behavior. While that is incredibly common, particularly for children in the autism spectrum that are sort of in this mid-range, meaning that they have mid-level or lower level cognitive skills, it may not be quite as observable with kids with a high intellect, which used to be formerly called Asperger's disorder. Now, autism is called autism spectrum because we have a range of kids who have lower cognitive skills and higher cognitive skills. For those kids that have higher cognitive skills, many misinterpret it as meaning they're high functioning. Yes, they have a greater pattern of assets with those high level cognitive skills, but it doesn't mean they're not impaired, particularly socially. What it means is that they can compensate for their autism symptoms with their high functioning intellect. When we think of autism, we also know that many kids on the autistic spectrum, or what we call ASD, many children with ASD have comorbid or co-occurring conditions, sleep issues, stomach aches, skin condition, anxiety, OCD. These are all things that occur at a high rate together with autism and make the disorder even tougher for a parent to manage. Kids with autism, besides having repetitive behaviors, often you might see a loss of skills, particularly with our young children. They may have sensory processing difficulties, difficulty engaging and maintaining eye contact, and they definitely have difficulty interpreting body language. There also may be a lack of engagement in the social areas. Even though many kids on the spectrum are very interested in social interactions, they just might not have those skills. And really socially, where their biggest difficulty is reciprocal communication, which can be so confusing for parents. At home, particularly for a kid that is higher on the intellect scale and may be what we call high functioning autism, formerly known as Asperger's, may be able to repeat things, may be able to have superficial conversation, but that deeper back and forth conversation, like me coming in and saying, "Did you have a nice weekend?" And the child saying yes, but doesn't then ask me how I'm doing. Now, sometimes they may have learned that skill, but they say, "How are you doing?" And the conversation ends. These are higher level skills that all kids are learning. So if your kid isn't perfect on that, please don't think they're on the spectrum. But a lot of times these signs and symptoms are there. These kids may be resistant to communication. They may be resistant to interaction. They may be stuck in that parallel stage. Most kids on the spectrum, really, they're going to show restricted interests. What does that mean? You know what I mean for those of you with a child or who work with a child. It means that they are so hyper interested in one or two areas or areas that switch. What are some common hyper interests? Thomas the Train, spinning wheels, elevators, things that are very different for each child. Restricted interests are very unique to each child, but these kids get stuck on them. they almost can't have a conversation about something else. They always seem to bring it back. And yes, all of our kids get really into things. Even when they're really into things, I remember my younger son was really into the play school nights, and we would play with them for hours. But he could switch gears and we could do other things, where other children I worked with could only do Hot Wheels or Thomas or whatever area that was restricted. With young children, what we really want to look for is a loss of skills they might have had, particularly speech, difficulty with eye contact, not responding to their name being called, problems following directions. These are all things that you want to alert your pediatrician to. What are also some common issues that children have who are on the autistic spectrum when they're young? Stomach ache, sleep problems, rigidity, those restricted interests, lack of engagement, particularly avoiding eye contact. These are areas that kids should be developing normally. And if they're not developing in these areas, the American Academy of Pediatrics revised the guidelines for autism in 2020, and you want to talk to your pediatrician. We want to get early intervention if you think your child is on the spectrum. It's so important. And if you're not sure and your child is older, reach out to your child's school, find a developmental pediatrician, find a psychologist. There isn't one test to diagnose autism. It's done through a clinical interview, but there is a test that sort of is the gold standard in diagnosing autism, and that's called the ADOS-2, ADOS-2, and it is a semi-structured, play-based interview that works with children who are really young to young adults. And it's a great way to really uncover, particularly in that pragmatic language communication and reciprocal interaction. So many of our children with higher IQs, you might not be able to see those difficulties, and they might have been misdiagnosed. Anytime kids are struggling with information that is not explicit, one, it warrants intervention, even if it's not a clinical issue. But we want to look for patterns. Just like if your child was dyslexic and had a hard time reading, or had a math disability and couldn't learn math, with social skills, they can be taught too. They're just harder and require that direct intervention. What's my Dr. Rowe know? That kids on the autistic spectrum have no social interest. That's simply not true. Most kids on the spectrum are interested. They just lack the ability to connect or interpret body language. What's my Dr. Rowe go? That's getting early intervention. Like I said, the best life outcomes come for those kids that are getting direct intervention in those areas that are most common to autism. They need help with understanding and interpreting the social information, and they also need a big toolkit to deal with stress. Kids on the autistic spectrum, due to the rigidity of their brain and how they process information, tend to get stressed more easily, and I like to say distressed. And parenting a child with autism can be really challenging. So getting intervention for yourself and your child is critical. So remember, if you or a child you care about is struggling, it's going to be okay. I'm here to show you how to help children and teens feel calm, alert, and good about themselves. I want to hear how you're supporting a child with autism. So leave some comments below. Catch you on the next episode, and remember to subscribe to the Dr. Roseann channel, where we talk about natural and effective ways to reduce and reverse children's mental health issues.